thank you, Pastor Ababa. Thank you, Mr. Williams, for those words. Fear not. I think that's a very important reminder to us. God is with us. And قطروا مال سودايقل دادو لين مقلات كده وسند على كده تيمريد المضخت كده المقلون وده من ساديوس أوبنجت كده عمره وسه بالوضع عمره الغل تنقل باللو هذا مترتي على بدوسوس را أي بدول مرقلاي مر بقول بيلاو بيلوم أبي رقلاي مر بسيل بيلاو President را Senate ما رقول Senators Speaker House ما رقول Delegates Vice President ما Cabinet سيلا بنقدر على التوتاو ديريغل Governors Leitors ماربك الأدر بيلاو كالغارا أي بلورن أيان المرة هتشاريجي مانغارا يكرل بيلار الألسيلز مال لويل توتان مرغمي روغوي كده لما بتوقع بريس كونفرنس كده الألوية مستر سولي مستر سالفادور بران مرينا سولي لامبيديا التيرا مرور سيلنغار ألير لونو سيورجي ده لو تبغى أيس المرابلو مار أدامو ومدني يجرقوني يا مكلو توتلنا أشاب الوقت بران لمرينا سولي لو مقدر على التوتال for the third press conference ألسلا 1 week من أقول له كده عمدني واسه سرا Friday night بدو دنيل واسه أتيا first الكيس را COVID البلاد testing positive first 2 cases دي شغله إذا سنقا ملور hospital سل جسوس مجيدا با EOC مراد شو دمرنا سوللا دكتور مقول ما تيمريل تيرا وكل نرال up until that point الوكل take over commander ريتر أودوي ما كفار دي سيل بقول سوارين سيل جسوسا سيل كام مالوبين كلورين ترجال ستاف رجيدا administrator هيلدا دي ملقل نرا panic mode تنار سيل واسي نراي الجيرة ده مقرأ العالسيلس الجيرة التال البنغلات عمره الواسين بتوقع أولن هذا الأسبيتال رجيدا ما هذا Ministry of Health and Human Services رجيدا قلت مقرأ عمره الواسين غطى تمال عمره روبا قلدوس يملول سل لومولا ميتين غاريانو بس وعمرون غاري سيل confidence تير غدمرنا سولير سيل cooperation or other ablu tira matatalo li tira sebo mia yo borgit god tilo dan ma yo borgit de regal confident le tamdayn lo ase qadon urgida qalt muqna hospital mat muqra ada ngaria room sergida ngaria don urgida qalt muqal takrar our patient e de regal madayn lo ase ngaria gar al sum ngaria dan mal mosmer ngaria gar e de regal madayn lo ase training am la momre umra lo ase yida alo dengi masadak tu yemada do en makloarandi de regal mkloar udolen ngaria experts ron asorgi del ngar outsider me kadman mrenga sulel se blue ramregal masel partnership tir mal dim lemre del odor klia doctor Hancock a doctor kiasel merbelau en me orga asorgi del wase so magrada address tial covid ma how do you live with it عمره الوثائق لو تطلع بعض الستندرية أضربلو يد الكاوكلات كني كده عمدني الوثائق الكوبي ده دخل بولا خرابلو لا مالو بارخت الويسي كده بقول يقولوا لا دخل بولا ما بايجي ده المسوب الوثائق مغراضو المول من كيلو بنجيل مغراضو المول من السلب أقرأ أضربلو من دقة هذا الماذل بيكوسر تقرأ كوفيد السي هذول متمقر جدا الجيران ما هو أولن عمره الوثائق ملي مكلورندير على الهوسبيتال ارسل كسوسر جاي ما ميتي مكا مرال دي مرغا سولير رامرين لودير for the past 18 months التيرا امرال our nurse martokta ma the whole ministry whether in surveillance team everybody has had to work extra hours and overtime kada gidan if anything yada مرغا سولير سيل مرال مرين لودير for the past 30 album. Kita mutual ngitra kaloreng ma cooperation ar adrablu. And we want to assure adrablu lo sa kita matmok la igir rogui el sabet and make sure ar adrablu selva akla. Atarawi raisel de rena sir eli ari reng selva se sel dungura tokora a vaccine, the cell Pfizer vaccine. Amlamo FDA approved. Ngalamo deka reason arada deka lolar vaccine. Ase other was say murgo mga vaccine kami say hopefully help rather amregel matmo vaccine tirling. Ngani tigil dimna lolar vaccine ase tia deka mereka FDA approval ka dingar said emergency use. Ngada hope lo ase se help protocol other amregel ma other mereka rabla ase ba mga vaccine la ko madakta. Akpadir was say kita other belam rangal tangatling. Sildo yung pasyente ka fora ka tangara 99% tra tigel maklol adam la vaccinate. Ngari ar sesed dirgam del. Kadong kita sel al blabol blal tobo de sel aisra FDA lo say gamna mo approved. Umra lo sesel ko to klol tutrel tokol dile Dr. Hancock and mirror other belau. Vice President tawa say al sumo matigar udra ngalget. Al sumo suadal el protector ngalget. Ngara sel ko truil se other ruling. قد vaccinate قد مرا لوني ترتريال سيسل مدين وسيب الال بلال بون مريغا approval على FDA ngara Pfizer gid please ebo Mr. Other Ministry head de mayo borgomiu mother protector ngalge I think seguida ala got to close to teleleng gida tial toro gobi dangar ale de rogui ngara ale de rogui kau klatka ngaria atara ahorita so hace triga idele medras kogi gre luil bem dongo se tire dongo simmer tire dongo albusur tire kadam karan dia kita gira der gainga show tiger medras kogi me please mau maska nga test kamiu eda kau klat ke kita di kau dengan other bela ma lo se to ata adri gamlei an sumari al gamel dir gamlei dunia se bom lalak be halal lam sal dio mais kita kada gainga show le tiangar le del blue ro kui mang kada gainga show ngara almongar ale rogo inde kasi dingwa rogin ngara almo ministra hel deleng mal obradal alun nemon nga sortir ma ay manera setial tokora covid kida tedobra population ergid adegal other belau sokal wadi mokmusia sel tokoram rigel girel tiangaleng kida bebira timing dekalo dengel wasengara kada melgoy ngab tulul oider maral dirikan mong without the sweetheart. So I'm just going to take a little time and speak in English about, first of all, we have to be very thankful. Thankful that I think we're a blessed nation. Blessed nation because we believe in God. And I just want to share that on Friday evening when I went to the Ministry of Health to meet with the EOC team, I felt the confidence and I felt the calm in the office when we met as a team and felt that they were confident in what they were doing and they had a plan of how to proceed. And I say that because I believe that they're confident because the people of Palau were so willing to take the vaccine. So we're the most protected nation in the world. We're confident because they were confident because they have the equipment to handle cases if there were cases. They're confident because we have the medication, and they're confident because they've been trained. And they're confident because of our great partnership with the United States. And I have to mention that because our partnership with the United States brought the vaccines here, got us prepared, and continued through this pandemic with weekly calls with the CDC and keeping us updated on the best practices on what to do, how to keep our people safe. And then, of course, on Sunday night, two doctors from the CDC arrived in Palau, and we're so thankful for Dr. Hancock and Dr. Cash, who are here to assist us in charting the right path forward to continue to keep the Palauan people safe. And I think what's most important that we need to understand is COVID is here to stay. It's not going anywhere. It's a matter of us learning to live with it, learning to adapt to it, and keeping our people safe. We were prepared for this day. This is not something new. We knew that this was going to happen. But what's most important is that we're prepared. And we just have to thank the Ministry of Health and the team for all their efforts. The doctors, the nurses, the whole ministry, every staff there, continuously making sure that we are safe, conducting all the testing, the vaccinations, and just keeping us ready. We need to thank them, and thank the EOC team, because the EOC is beyond the Ministry of Health. It involves other ministries, so all of them coming together, and also the NEC, Vice President. Thank you for getting that team together on short notice, because that's what it is. It's about people's lives. People's lives matter, and we want to make sure that they're the best protected possible. So let's have some confidence and fear not, I say. Diregal sokal ngutial teal man brenga sulala olvira galulaw Senate eling man le kamala session tirak desem toka albangalir diga brenga sulir mle approve ra Dr. Dale Jenkins mo bes el Ministry of Education mo kadaman brenga sulir diregal mla approve ra Miss Iliana C del mo bes el ambassador yid in United Nations diregal mla approve ra Mr. Noah Alaimul mo adala board the Foreign Investment Board. Sel ako tel kamanga lem katatal do sa odri tokoy. Why say? The mga sulele Senate Minister of Finance. Do say at least em na mo tal baga sa la clear first house, la clear Senate sel tora tax reform. I know lo saying toka questioner adrablu, but at least we've taken a step forward. Deliberate, but most important, conduct a hearing. The most extensive work rangi el bill kung daso kadamla a facing your other bela kadamra nga soldier sel al mring lulerir sel uk passing ni raha Senate ukoni tra house matamo al bangari ori diregal kada mereka sula la minister ma ada lok minister ada house loko sta beginning na ulor gire la yosang angargit diga ya gire kaba gire makal maral yosang angama a tax reform kada mereka sula la olbira kalulora aureril gire tia paidik ngatse paik ma ular mun sa darla darla pura di update tergidra sera last week laria question gira WIOA marcel ko di update tergidra latest what's happening in WIA
so ang latest WIA obisa lahad so starting next week in girel full force obis morngia BSL acting executive director. As you all know, yung nangisel appeal, and so elang mo nga acting may vacant position sa mo field, but going forward starting Monday yung the office will be full force. Elang obis sa Orior with the CARES Act and regular programs ngaringi clear ang ngartang other office malsuko mga nga specific questions sir kami will regarding the office ng sabihin ask kaningi give ako ra dimle updates ang finance adil to by the CARES Act as of right now and so if nga questions sir kami regarding the WIA ng sabihin answer or clear ang other offices answer.
So do we not announce ang kilang BSL director WIOA?
Oo. So BSL mo director el gimil ti Glendalyn and Yermeril. Kaya kita mo take over
Tao.
Tao.
Adam,
Oo. Moster atam tanglit Tao.
Så det am sulang I think saya diri kal matatal dong iri metal to the announcement temla selectra abesel director kadiri kan mo waseng klo abak klo ora adon matche kartir and I understand there was a problem, a process takes a long time because spare our staffing material the more our staff and more room but bring us to labor that have been acting losi krole let the more staff and most other speed up our process the understanding nga dala 150 at the process around 1 week the 3,200 it takes 8 weeks to get through sale list or something like that seguida dola samal melisiri mangari adal mal madengel tadi approach gidra pulara lo se ache gargam top dro ingra di I know lo sen mrin aurel girel verify girel kutmokol mo ungil tu era luidi sem que dio linha trakalo ngara adra blu waise oh yeah, well, let's go ahead and ask Dongira Dr. Hancock. Bon, kadbay da go ahead and ask a question.
Ali malungil President Marvekla. Thank you. I do have a couple of questions. Medic ask and then whoever mo answer as will answer. WIOA. Okay, thank you for the update on the acting director. So question say sell appeal nga rin all time. How long is that going to take? Wangarak lang mga tel. Kita mo mga outcome ni. Ang ngerong sell kasi nga will staff I mean you're hiring all everybody will fill up positions. Temal telal ada employees ra WIO all time self do as a full staff at telang. That's ka sita ko sa ng tangali. Mal the additional more say maral beto kar adal tir ka masada kay gid payment tir baseng malmeo ta lak alwida last time el kung tatura interim director to kasi ngari gel bebira tadir ka marula gel babilingi ra bebira at from March and April and then mangari aklol delay mangkorawa nga starus ra. How far along are you? Kung lamo nga ra ready yourself sige dalwal lam nga ring matela kung la complete ra March ma April melang May June July or maldi last question I'm sure nga yabe bila question bila kaya WIOA sel el payment ra SS lak alwi de to ase sel payment ra SS agel SS contribution abol lolto ba mang mot tabtiro hingarang ya question kire like health insurance ka deductions ay kaya nga niya ako ra decision rabor dalo sa makarabol address ay kaya lak alwi de SS asen maringat tira refund ay kita luto mang di kita question nga kalsumsumil and settle one by one and that would be great so lang
mabako mo ulit question number 1 sel appeal sa LA nga sa Mora State Board State Board ko kanya procedure certi leng swadal separate duties mang since termination at of the local board yes the Mora State Board al appeal and then State Board mo determine ilwase o yung tabakara decision ng local board or the terminate the decision ng local board and then kung nga appeal raad mang intern ng muton may order office. So sige da kung dakat sa answer sila wasing wangarak lang mga tala time leng cook decision na state board and so that would be a state board question. Number of staff so ilak mamle ilangan nga interim director nga nga 5 staff for ilang ay ginahire additional 1 staff And then, naringar 2 student workers ra ma'am. One are more reclassified and more permanent. And then, naringar, I think, terong al PVA and the ODR. Lalo nga sera, igal number of claims. And so, I think that's 9 director, Alex, Wegner, Terul. So 9 al-ang. So starting Monday mo 9 al-ad. And then of course ng mga angel acting omdas awal mo lang sengi, and so they'll kind of delegate responsibilities until mo comfortable as executive director. And so 10, and then tigil mo madela 9, including our tigil terul PVA. So once tigil terul PVA mo ka PVA program, engwal 7 permanent staff. Sel question ako number 3, akla mo as karaklerang mang mo and serengi and gigida ODR mainly with the claims, so they would know lasing wangarang status ra claims processed.
Malungil 2000. It's on. Come, some repeaters the question ko ma'am.
Claims. Last ko interview kami kung say ngarigel backlog all the way back to March. Kung di ka process sabi bira application sa submission sa March mang al time ko malkiligir kung lakyat sa apal mo al August ubeng dir ka kloa leng mal concern na betukla ngayap tukla basing mal makatatal ti mga payment all the way back to March. Ma question na say how far along are you on that?
Kamal masulang ra kari me ikim la start up to date. So as of now I'm almost in the claims algin process ang alsela chula el May I gave the and not all langari trigger baby will give them question or dear may gigi the wal gora give put aside and then do investigation may gel teletele la the most ringi am na up to date and mo at least last month.
Okay, and then sell payment SS. So say more a discussion board meeting of Ma'am Thursday. So we'll be able to answer that question. Leng dira kalgira mal mo mga adura di OL algira la leng dim na kalgira ng tax deducted from Nikaludod. So meeting ra di OL and then agi mo board meeting ra Thursday decide waseng ramo mo kalgira la SS ma HTF.
So, tutaw. So, in addition to Leilani's question, staffing, wasing article vacant positions. Ma-question ako sa vacant positions ang tamlan nga ade may resign, alo ba kung recreate a position. Understand that because of tel issue ra tel monday nga ngi ikitel lo metangel wase ya ngai kitel amis bulong ong am nombre kalorior pakwasi gai kitel el vacant position sang ada luar say tidak kam nombre kalorior kam kora siam momotlise.
So ang naringi a position already in the vacant tulta the announcement then are apply and then I get rest ra amle positions are adam lo dakalorior kal position mauul mang lo open luwa executive director
Makarmin ma ikikit ya
oy
Sulamis dalan babauta
oy
isabem lo aisak mong wangarak lungel no daudan kayal el giriul mo dispersion ngai etelagel made logiu sel extension tial el ngesen mervelal kirel mo expire September 6
el aigel muutuludo the aigel la laps na matatsa de los pe. So elang dim de la extension.
Sebem el magataklit il almo blaktakla. Ngani ongit lamora Department of Labor kung sega mo o labs mo itigdam la problem el development sebe del extended ni. Malu be gom ere mang labs kami amo spet tal beseludo del expire September address ay gan namo miracle problem. Ay gal pending el claim.
Tila wala maring nakaka-answer. Samal mutal ask a question.
Kakla saygel mutuludo
Paisay.
amla expire.
Mm.
Sebem lo ay sat muntelak lungel seludo den la expire.
Di ako dingel wasing talaludo na expired.
En telak lungel audo del pamo spering el disperse ay gagi the claim el lolo ya Clara.
El atil ay kita sabi akal running yung coming while dim lak prepare dal mer el tutaw mang dim dako dang lak lungel madel akti mo dingel wasesel giblem to ring amle ngara 2 million ra PUC ma PUA sige lagi mo spending el disperse el altam ding sabi akal mo run ay gagi dal numbers balsumang sabi mo this person mo kami.
Sebem el direct mo find out track lungel audo del PS el model.
Oy.
Legal gerel mo expire September 6.
The clarification, kumura lo serada ya really submit a claim active.
Why say?
Even though multiple delay and we can still pay after September 6. Why say?
Why say? Gibil data the claims prior to September 6.
Meklutel mega follow-up question. Elang ogi tegi the process ra WIOA. Tangari aradal mle elusa employment tir. El mera osisiu luriore mergo dimlak lungila information tir el mot. El mo dimlak el filak. Dimlak el claim ay gel mle giril claim el lodo. May gel lula wal blel songs ra gel. Tirgen dia kate lir el mut el file.
Clara.
Ngar nga te little sa il file ma pay yung irola la pay sa baril mer officer ma magi i ottaw da feli re mesak mulwasen ngarangal sangsel ma kuk mesak mulwasen dir ka sa pedal malmol malagang ngaraul giral me makada mesa pa biling yun sige da vital rolel
Mansula.
And the for clarification ma lo atalorang will understand that sel mention ra kay kital PSL mo acting director atawo understand was ngaring sel appeal ra CFP
Why say?
mal sukuma apor da ako ngir sel appeal ra CFP what will happen to tawong wangarata mlewangara agreement arrangement
So hindi oriora al sila obis. So tiadi if situation. So if state kung ngay ma director mo to return niya tao adir nga position ni mo reclassified but you will still be in the office.
Just last question ang algiral yes, we would really like to get may information algiral luto. And the question say tell investigation alak alwe the more sometime ra February algiral complaints ra WIOA akatangara August ngaringi ako ra update blamul wasing girel kera auditor la special prosecutor el girel tal investigation
Malda ka
me komeng medic da bengi mispa bauta kama mamlesa na confidentiality plus aware gi mo sa tangi dil ngarang in regards to the investigation engira malmalaya ako ra kangay or advice ra senior legal advisor ra president ra wala gibo mo sa dangi fil nga in regards to the investigation. Oy.
Hindi ka pa timeline ng mga ramen. We're not asking for the specifics. How far along is it?
Even that man dakal sa mabal sa paring yeah.
Ka president hindi ka commenter ka hindi na kal ngayon la advice ra adral la arkaw.
Hindi ka adarala amal diol nga seo. Nga amal dia ngaral gudong el gire. Alay hindi gire lo nga. Hindi ka kadim dia sing marala urior. Tapos tira te al mlolo la ureri. Sudah. Okay. Halak mo wala nung sa abay sa muka.
Mansala Presidenta, ate alal mo sa report awala NEC malungil tutaw mar minister sa director sa tikale adra WIOA media kagita Dr. Thane Mlame Dr. insya Allah ay sulwa sa NEC mlemi talabangela ang kagita Dr. Thane Hancock ang kagita Mlame joiner git mangkagita incident commander Riter Uduch amle mukte karsel meeting alo bangela tilkal Dr. Hancock ama kagita Miss Uduch ang kagita Vice Chair NEC ngarte Minister Obi Amlo sa amal tumakma material member sa NEC amlo allow a member sa NEC mo si ilogera gelgeral mangmo at mo blakatakal ko rawa ba sa edal mom nangit mula sa gida salba akla mangmanep to kam gilger especially giri rarngalo ka al tira dirga kalunga vaccine let nga rio ratrum erong arakrir maktil mo tal mo o isay gel blaldo nga Mr. President talwasay ako tulungi ral al gida sa edal sa kaltri rarngal garbelaw al tira dirga kalunga orus le rakrir nga rio ratrum erong kidal makrol af podongo orus selbo longot ado ang kagidale Dr. Hancock ang kagidan lameng ang wasetyal vaccine bladong ako raw ngu atamel ang foundation ng protection ng madukor omes ringi siya longot ado tigida ko ramera uldo suwe makso kal share ang kora mo omes ra tamanengi sel kmal al sel sa vaccine ka mo loya hand washing mangkuktara a layer to korbela tara mul mili o mailari ko nga maskal ngulo yang ko smera tretra makadingarablim may gaygid yaygel layer upon layer alngia sob aktit diesel ko tal best protection tegi del vaccination kagita Dr. Hancock ang artaman si elmo talmo o ensera baby rager hindi mloriate elelo meser sele mitigation guidance alblel adaptering NEC recently makmalora nga sulel nga niyam le tablol ko a major comment sa ngira alwase polse edalungil ko smisi ay gel triggers ay gel from one phase to the next edire ko wasel bol nga niya provision ra alsel alargi the flexibility men sa edal al mungil identify gagi the phases e move from one to the next may gimome sa gagi nga mal masaul al dire kalmlangu ti al babiere mo o mesringi in depth line by line tira kal seguida kora tora en isim selgi murale o bangal al dado awa say we are safe kidar el ang salba akle kidal mal ngarbab sel vaccination rate tari number 2 sel NEC el ang mo mitalo bengela incident commander by Zoom rabek kal Wednesday taklo yagyo sume ado aleng club ko la ko tangay kay kidal ado edangal mo ray kel danganingil agencies our families communities edong ado loba imol to badra incident commander of mangkagidele deputy incident commander akafa seguida ko ra NEC ngak Mr. President if I may para address sa tramle question na laringira before Giritrial terol officers black identified tir mlamo tutakla ma sel tutakan la kut makli attorney general la file ringi adimle imong alumlu tutak ringi tamlo tutakal unlawful taking a turtle why tingilo awel radim lakal temela ngayul awel. Isel waset amlo so isabrano entry no take zone rang darak. Amlo dia kal sabi el sel tabor ala elang. Ay gal la statute lagi gal pala national code. Engdi ngaru Macau mangaru kuwit. Ay gigi dia wayal no take. Mangdiwan al segi dia charge amil katmokla against tirkagi del tool officers. Eki damingi already Attorney General, but for now engel buli sa nga suspension without pay al mangira tial case ra Officer Attorney General whether ang plea agreement tal ubeng mora trial ang conviction kita kuk mo Mr. Sel next step. Kaya tim lagi kita Mr. President sabi update.
Sula Vice President dak pa kung alam mo sa Gafar man ko ram skeda update direkal ngartia director school ada mang direkal sir skeda update la to school
sula nga Mr. President malungit total mo ka Vice President ma cabinet members marugul adara medial ngartiam ya kulungit total mar adar bela rugul loreng sa Mr. Tiara amitia so kada malmol الهوبفول نقول أتيك وسيق دم المول من البوزيتيف لين دخل سودا بوزيتيف قدم المول من الهوبفول أورين الوسيق دم المول من سلب أكل up to now mal diri kat tablong kay sirgit ta remain nga isolation hospital diri 26 el close contact ngariya 24 tir lang wa day 3 test negative tirgel teru nga mamalaya day 3 test tirak lugo so kadam mol ngar sa igidil di kargikla mangila igidil result tra attest so far tirgel terul case tirga ngara isolation stable al daka kura all hotel akmut tamaral mo smer tial rakt hindi again sa igidil protocol set ngara isolation al truyel club sa kadam mutal test tira aday 10 kumdaswa Vice President na kuk isi segi del tara madalaw rele del kuk Commercial Community Mitigation Plan kada madang la Dr. Thane Hancock kama Dr. Haley Cash el ngater el alobongge del ol nga sergi del omes egal el teletele lauriore ol nga sergi del milisi ay del gora amersel ma agap seringi Munguldi mukar sa igid il National Gora Community Mitigation Plan nakdiri kal mlaw ay silgiri laguk gagarel work group kamamar other education ma private school ma head start at makaloriol guk komes sa igil plan ra school kada madingil was number 1 concern ra parents ilang arangal kal ngarior kira 12 tirgal dakal si ilmalar orus ilang sa igid akuk tara madalorior ilal longot mok keringi lutur sa igid al National Mitigation Plan. Matirgal terul tokta nga wal kuram la obi ma Thane audiolo manggala in isilo Mr. Cloud Plan ya kuk Dr. Cash audiolo manggama sa igid al gagarel group alo Mr. akuk School Mitigation Plan. Again, sel do Mr. Sel National Plan Mitigation Plan nakadangara stage 1 ak madangilo sendi kakat magil kora usis akal mara adara blue gay gidil kakarosel stage lo sesel dangarawan ma 2 ma 3 ma 4 ang ngaranga kat magil mga rarwol hindi kita ngar sa igidil stage 1 ilang alwal kada selba ak ratiarakta even malboring other style gay sel blue sa igidi akora telet sa igidil plan makada malmol mal lakada mesem liwak rateb nga ni mask madaklo mask Dr. Thane adir kagilir dar nga raskogi manggire low mask kasi gidia number 1 tokon mo tirgel dir kamlay to mask limit tay gel movement til mora aurior ma gel essential travel and din dia ka tomera adal sugum so low mask il at time ay nga dalu melek kalwase kada kay ngisew ma kada muten mereng asulir adara blu megel shobile di tir mla initiate protocol certir start preventive measures even though hindi ka kadabor sa igid stage el Ministry of Health and Human Services malumong NEC mandate mask kama face covering sa mga pearungud lo ser ada ditil tega ownership ra helder tir ma initiative el mga tmok lagel das weng mom sa akkertin. Hindi again adungura tokora mas kal sugo mo ko mas ke pomungil lo mas ke pomungil lo speringi. Mang make sure tong tengang rem rogir mai ngem la kalukura di ngariora isngem giret lungil fit mda kalukura ngani atte lela ayol totto do sisit time president ta na mo mess up to kal maskal di eloy tarara no da direct lo langit lo lingit tar adra blul wasel sugo mo ko spe kal disposable mask mo takang oy tira di oy dispose ringil responsibly mora abli la ko mi malakal beridra rael malubong ngara di eloy tara table sugum kangar office marael gukire la tara adal mum o mga tmokril mamoy tringil guk health risk kal mo ngi gidal adam kada tmearungu they encourage our adam to practice the preventive measures and at the same time kada lingit lo se podo karigik ra ko mirigid including ramas kal sum kangul oiti directly president la mlongiate lela Dr. Hancock kal mora airport el mo message sel guk uldas lo se ngadik merda skogi kada test tirigel el mekmerda mse agora uriol ongoing kada mesringil lo se wangaranga klungel uriol dal bangaringi sa igidel testing ra airport mga ray disir adal required el morseng toktang nurse adan sa edel spera kukti pebira non clinicians mse igidel gora omsuba ada gimot mokring al sil so hopefully by the end of the week and sa eluranga niya report del mera officer president la seseng sa in makatmokra Sunday malugan dia di sa igid akum das yung la akora goal gid lo sem makara lut tel mangan milisi ay gidil al preventive measures already gid na in state to sell na start to sell day one testing mutirga gidil wa Dr. Thane amle test to sell tutara Monday day one test mang tirga rogul na sa igid test so far at negative hindi ngora swad el mood el smisi isa gid el urior makada malas malomes ra airport sa makada dilger del test el borablu el restricted movement el lut el mersa gid el day 5 ra hospital me test so gid akora baby ra urior direct mutet te al mrenga sula la Dr. Yanon ngam la mo start el test ra COVID-19 direct el senator Corte ma Dr. Amay samla ko ngay makada mo expand the testing el mora a clinic etir ma adara labra hospital a uriolo mentria adara labra gel private clinics el omestira tablo regel abot ID now machines lo bangela training ma bebir test kits men sabi start el guk motmok la testing ra private clinics so el al time giolingit lo sa gel day 1 ma day 5 test ra adal mesois adol mol men murur hospital hindi motob da later mora minister obiang ma agarogul airlines el wase selbol marega training regal clinic rogui en walbol sabela airlines el accept the result tertiling ngosisil training mo sisil teletan mo sisil masila lospel el marura test ra COVID-19 el wa hospital mase direct mo ngosuguma malguk alleviate sel demand la testing el programa de ingeniero se selbek long imulurio mal masek de sel madal hospital adal me test ra day 5 ma direct el adal test lo spera test result el master skogil mo marail mo seguidi agora tetela laurior el angra gukto ko testing agunda sen adige gida updates presidenta di one loklat ka again tirgel dirga ka lorus el 12 el morba barakira next el pada a Friday ang yaw sa gym ra 2 p.m. mo 6 p.m. Al sugo mo ko bang algem el me hindi ko sisiyo el requirements minor agil accompanied ra either parent o legal guardian mo tangang lalaba ID may gigid necessary legal paperwork rang algem el mamala first dose al sugo mit second dose en hindi ungilingi din nga ni adult lo bang di sugo nga ni angal kalmel nga riyor agil 18 yelo lo bang parent o labay gigid documents. So again, summga niya ngidil adal 12 and older dirga kalorus sige dia next te al ra omrus ra Friday ra gym ra tool mo 6.
First of all, we didn't speak in English, and I know there's a lot of people that don't speak Palauan that might be listening to the press conference. So we want to just let people know that the Ministry of Health has a Facebook page. which they post data about the situation and about what's going on. So we recommend that for those that don't speak Palauan sometimes, if you want more details, please go to that Facebook page. It's the Ministry of Health and Human Services Facebook page. And, I was just looking at the page just now, and it showed that since April, we've tested over 8,000 people. And we've received more than, inbound passengers, more than 3,000 since April. So, that's a big accomplishment. That shows that we're opening up slowly, and the systems work. And most importantly, that we need to have confidence in the system. We need to have confidence that we're protected. And we're just grateful that Dr. Hancock is with us today to help talk about how we go forward in a safe manner. I think, Katina, and the media, if you have any further questions. I just want to add that Director Maol was telling us this morning that there was high absence rates at schools. And maybe, Dr. Hancock, we can talk about this because parents fear sending their children to school. They've come down a little bit, but they're coming down slowly. And I think it's important for parents to really understand what the risk their kids have and what are we doing to mitigate and how do we keep them safe. And I know we've talked extensively about this, but we can continue to help people understand. So, kamwa di share Director Maol ra akti sola dalo iso sing ngomigeta Dr. Hancock ngari sin malungil al Facebook page ra Ministry of Health and Human Services el siya del moria ma abtol information ra geru guidelines ma information la gira larak siya la most reliable hindi ka mo mesa bebil kom di message sa gidel al site na Ministry of Health and Human Services siya accurate ta mo ra algorithm كده وليترا ديريكتور مول مقايس كده يل absences موليترا دكتور هنكا مقرا مقايس كده واسم مرغال كده البورا سكول نرا كده البجي نرا كده ويل discuss رلال تام سولانيا
نرا تتا president ما ربك لان غتيرو غوي اغوت دي بوك كويلغام را دكتور جينكينز الميرا مينستري education ترجع على ضمن جروبا كانجي ملا ودير اي او ام التلقي بالتايم السم لو ريلا ما نبتقل تايم جيم دخل ودير يما سكول المليسي اتقرا ديزاستر ريسيلينس ما تقرا ايمرجنسي دا اذر مينستري ديك كمان دغليرا سيجي دكتور ودير كذا ويلكم رينين مي سكول دير لان ضروره المال ديال تيراك لايجي الجايدنس التوبدرا Ministry of Health and Human Services to win itale EOC mong school malmol ya kung continue collect daily attendance makadong din raseng to nga Surangel mera school mardiak egel direct preventive measures nga egel guidance ra EOC adult tra school direct el time en direct abod mandate ta egel maskal marangal rogoy hindi ako all kabay rangal low mask mera school masayid al tletala ng ngi ya ministry malmal melodiyo lo mangela ministry health el mobilize mask or sell event the mandate ta mask ka already el browsa mask marugul nga school head start el malmuta PCC sayid ako rangara outdoor lang di Dr. Hancock yesterday we monitor daily attendance rates for our students from grades 1 all the way to grade 12. Yesterday we had an absence rate of 18% of the total population. I mean that was Monday. Yesterday it decreased to 12%. Normally we experience between 3 to 7% absence rate on any given normal day. So my reading is that on Monday, ang Monday class of rather parents matalang aring lauder darang gir eli ang warnat talgibal el oil sangater mong berio sel mataptol ngal ka nira school eli compare than Monday ya kung continue malaygel attendance data for the next several weeks until the local rates are normal. Di ontigal mar parents ro ko yasing bato ka to il mrera blue di mebodo tirak laigel tol to dra ministra held seguida ako kumral wases el bodo aiseng mo hotel gibel kasa raureng ma ku confusion ra ablu ma to goni ara da maradil elega ida anga I osimo to da igel daily updates ma ige direct mera school gi remote mera school bela rogui mar principals mar sensia klagar lo ase wangara omso del tagi del case ra on a day by day basis del klagar ekalt mukul kuklani atchen sa kadam do lo ase madam barang mang segi de adictly marwa then maybe doctor you can say something about the attendance rate
And the fears.
Yeah.
Thank you.
Thank you. And first off, thank you for having me here and being able to participate in this press conference. Thank you, Mr. President and Ms. Vice President, and the community of Palau. So, first off, I recognize that this is a moment of anxiety for the community. Anytime there's COVID cases, people are anxious. And during those times, we worry about our children, for sure. And this is a situation where those 12 and under do not have the opportunity to be vaccinated. And so certainly a group of the population that we are worried about, and that also the communities are worried about. But fortunately, when we worry about our children, fortunately, when we look at how COVID-19's, the impact of COVID-19 in children, we find that they have extremely low rates of severe illness and death if they unfortunately catch it.
Dr. Hancock, we'd like to
Mike.
translate to Palauan.
Oh,
So not so long, and give Gafar a chance to translate, and then
I'm terrible at that. Poor Dr. Yano. Yeah,
yes, I know
but-
yesterday
yeah,
was a
sorry.
bit difficult. So
Thank you for that very long. Dakang hindi toktanga di okker gidro ko emrenga suletra te alel se elme ko kobang gidra press conference. Direkal di gel daala waseng madangel wase sebokrang ra bulur el alta magiri tirga gidil ngaliget altira dirga kalbol se ilmurus. Indi adomesra omsuber el alta metial rakta wal ndiakal sal hidoy. The long leader the age group. Is that what you said, Dr. Hancock? The severity of the disease among the children
Is
Very low.
is much
Yeah,
lower.
much lower.
So, is it just the severity or the infection rate as well?
So the infection rate is a bit lower in children than unvaccinated adults, quite a bit, but it still can occur, unfortunately. But it's lower. But the big thing is that they don't have the rates of severe illness and hospitalization that adults do.
So sa igidar magkakalingal kay alta marakuk kigel belul ngariya raktal ngara alsela arangal ka ngariyo teelil ngu mutal ngariyo teelela adalt dirga kalorus o sisilta mesel teelel qoramal musme el malumun yuing angal ka angariyo el alta mar maklolat.
And so when we talk about that foundation of building Palau's protection against COVID-19, that key piece is the vaccination rates. And the reason why it's key is that it does help reduce transmission, but the vaccines are remarkably good at reducing that severe illness, hospitalization, and death. And that's why we're doing all these things. So the fact that the kids already have that low rate is one of the fortunate things we have with COVID-19, that it's not causing a lot of death in children.
So sa igid al-Qura los modia Vice President loseng sa igid al-Qura watamela urior at igid al-Lorus lo mesindra maklol other bela amlangu ma o mesindra rangal kamlangu tirgel sa bil malaringi sa igid ya wal Qura qot al-bado الرولة اللي قدم السبا أقرب الوادا مترجع جدا الجديد اللي دخل سي المروس لسيجي الروس البلادمو mal bado الغبارة هذا مال سقوم مسمير إن داخل بول هيدول سير داخل مات ديرك اللوريور البنجي غير سيد التقال ما رقت داخل اليول مرترات.
So that being said, sorry, I have some other. That being said, we still want to protect our kids, right, as much as possible. And while they don't have the benefit of vaccines, you can help protect them by vaccinating those around them. So there's a less chance that they can get infected from an adult. And then add the other layers as well. And, looking at in schools, are there things that can be done to add those extra layers of protection? So even though they can't get vaccinated and they're at low risk of severe illness and death, but they still are protected as much as we can from COVID-19. So adding those additional layers.
لونجيل التلاتال ذوجيل ممسب أكرر نلقيت السقوم ترجال مليو الآدم مليو كرنيل مكلول آدم أرنال قل سبيل وأوروس لوروس يسيجيد أول غرة إيوات السبيل سب أكلانال لولدي مكرسي يجيد البودورو راسكول ما السلا بلول البريفنتيف ميجرز المنال دوليش سيجيد اللوسب أكل مرا ترجيد النلقيت الدين ترجع قبل سي المروس.
So the reason why, as parents, is we care about our children and the health of our children. What we found in the U.S. is that while closing schools takes them away from where they're gathering together, it also takes them away from school. And that also impacts the health and well-being of children. And so as much as possible, trying to create a system where kids are able to get that education that they need to grow and develop in a safe way is really the goal. And if you look at the U.S. from CDC guidance, we are giving guidance of, hey, keep schools in going, but add those layers of protection so that the kids can go to school, they can learn in a safe environment. And again, getting vaccinated. If there's any people in Palau who are 12 and over who have not been vaccinated and are eligible to be vaccinated, go out and get vaccinated. That's one extra piece of protection, not only for you, for the community, but also for the kids.
And if I might add, Dr. Hancock, before you came, we had announced that the FDA had just approved Pfizer. It's full approval, so it's no longer EUA. So there's really no excuse now not to get vaccinated, because now we know it's met all the approvals, and maybe as going forward, we haven't had to do this in Palau, but I know, for example, the U.S. military says mandatory, you need to get vaccinated, mandatory. People going to the government buildings, or even in Guam, you were sharing that you have to have vaccine cards to go in the movie theater or to restaurants. And I think it's important for the public to know that it's just we need to take on that responsibility. And I think from the government standpoint, we're definitely looking into the third Attorney General's checking to require the same sort of things, that teachers must be fully vaccinated, right? I mean, that's about protecting our children. And you shouldn't be allowed on campus if you're not vaccinated, or maybe they're required to get tested every day, but if they go get tested, they won't be able to teach if they're getting in the line at the hospital every day to be tested. So we've got to come up with ways, and I think it's important to emphasize that our kids are most important, and that's how we keep them safe. So thank you. Translate na, yes.
So atokta nga mils ulmo ulmasad alwasya school tal stop el bola kal ngara school arngal geng gigaringi segit te elit ma mo ula aprida la rak tendi osisil time ya kada malar tira school segit el moda kal ngara school direct kal ngania kukal tamalira ulguro le ngal kama of course school el amokte kara CDC elanga kada malmol mal school mang open marangal kamora school ngara school di ngania kaigit el preventive measures mitigation measures el dongot pokra al sela school el malasa mal marover segid el la rakta mang operator al sela school hindi sel nilutel duli sel gotter klutu trel al sugum tirger roguil sabi el murus الكمية تيرغالنغال قبول روس سيجي دي number 1 السبب القط مكلي which is أقوم داس قدم لا قط مكلين دي غني تيرجي كده درستان الأدير قال بينو أروس ما ده دي الموتلو أو لينج الترتيل وسه boda kayo nga seo landa kadi moruringil gira makamururingil gira rangal gira ma arangil gil bela rogi ibere president tende translator ka akamolo o mistake mutokor merigen morkaw
نعم سولا غفار ده غادي يوم التقرير وس سيلغوت كلو توتلل أرجع لجيه إملا تو سيل approval على FDA من نامو ده ولن ده نوع vaccine تريال رجول لو بترجع لجيه ده رابك كلسيلز أدم ما أديل مارسين سي ما يجي لباشول بوري أرجع لجيه بوم vaccinate لين سيفتي أرجع لجيه ده كلو توتلل سولا سيادي أنتي ده سولا على translation كفار Abang Olgaring.
Masawla ka for digil da bangi. Just for clarification factor then I suppose some people in the public misunderstood the explanation for the third shot that you were talking about. So just for clarification, could you explain again what is that for the sake of those who have no access to Google? And before you answer my question, I noticed that you're wearing a double mask. Could you explain, is that for double protection or what is the reason for that? Thank you.
Thanks. Maybe I'll start with the mask first. Yeah, my apologies. My mask that I wore previously that's a bit thicker broke. So I have two masks on today. And really, when you wear a mask, it's not, these masks aren't to protect me, they're to protect you, right? So what happens is if I have COVID-19, the virus that causes it in me, and I'm here in this room with all of you and I'm speaking, it can, if I'm not wearing a mask, it can go out and infect others. But by wearing a mask, I'm helping protect everyone around here. And I know that when I'm the highest risk person in this room because I flew in recently. I've gone through testing and that sort of thing, but I'm still concerned about exposure. So that's why I am wearing a mask to protect others, and that's why two masks. So, as far as the third dose, so the third dose is right now the third dose that's approved is what they're calling an additional dose for immunocompromised people. And those are people that have moderately to severe problems with their immune systems, the systems that fight infection in our body. The vaccines, as many people know, is a way to really stimulate and upgrade your immune system to be ready to fight COVID-19 when it sees it. And so what for people with normal immune systems, one dose, you get your immune system gets ready to fight COVID. The second dose, they're really prepared now. Your body's really ready to fight COVID-19. For what the third dose is for those individuals that their immune system is weakened, whether it's from a health condition, certain medications, whatever it may be, and they found that their immune system really needs a bit more training, right? So you give the first dose, it goes up a little bit, second dose a little bit more, and they found that adding that third dose really helps to increase their immune system so they're ready to fight COVID-19. So that's the first third dose that's been recommended and recommended currently. And it's a fairly small subset of our population that have those sort of moderately or severe problems with their immune system. You're going to have to translate that. Sorry.
Again, just for clarification as well. So for those who are going to get the third shot, I understand as you just said, it's for those who are who have a weaker immune system. So in the case of those who got the single shot vaccination, the J3, are they going to receive again another shot of the Johnson & Johnson vaccine?
Yeah, great question, and it's one that a lot of people are asking who have received the J3. At this time, they are not recommending an additional J3 dose for those with the severe immune system. So they say just stick with the J3. But that may change because they're looking at it. They're studying it now, so that may change. And also, just so people are aware, and I'm sure they've read in the news, they've heard from the White House as well as CDC and FDA that it looks like a third dose may be coming for people who have regular immune systems, and that's the dose to help keep the levels up. So you had good levels, maybe it's coming down a little bit, the third dose to bring it up. Now we have to wait and see. The FDA scientists and CDC scientists are looking at all the data right now to make sure it's rolled out appropriately, but that may be on the radar as well, or coming up as well. So just for what I say now at this time, J3 or the Johnson & Johnson Janssen vaccine does not need an additional dose. They're not recommending it, but that may change as they get more evidence. Yeah, sorry.
So kung mo le olgari lo gel gel la mask lo sengaram di tatablo mask ringi. Mamlo makatakli lo se mask takal sal masaba akkar gaul adalo mask mbay masaba akkar bebir adal meder gaul. Lel sumo ko barak te go tali le okluk le ongir te mal ubos ngose sugo ma ndaka mo mask ko iwilin murataraat. Di sugo mo ko mask eng gigiringi se gidal te al gaul lo liura raktel muratara adamang mas kamera ringi masaba akar adal meder gaw ngar bitar gaw endin dakal sal sob aklaw ngani agarel lurelel sabel sob aklaw din dia selong erul gel gerela ngelong edel orus milgat taklilo se ndakal booster ndakal wal qura ndakal lol el tel klisi el tel lorus el blamngu adam sisi abadengela al sugo mungungel qotto lorus en wal lo maksara batangel mo o kawatan ng virus ng rak te selong erung awal el CCE segid relel tirgel adal tiram ituta immune system til rak tamal umungan ya ukmodal uulang ngitut sel el soldara batangil lo kawata lo kawata rak tama at segid el virus segid long edel lorus awal lolisi raklisi el ngegidil longeru lorus mong mo sisiu ngi ma adam sisi abadingil wal bolo sisi waklisi el ngalorus ra tirgegidil adal ngania raktir malubunguk ngodulu ulen tigim bitu tabadingil so el time qadaw messer tirgegidil el qorangania raktil mngit utra immune system tir mo start tamirus tiselong edel lorus Sen leong edel gari malguk kire la vaccine el Johnson & Johnson lo se tirgel mlangu sel di imo lorus el Johnson & Johnson ngania tutilil mamalara ongerul lorus mong dilulo se el at time ng diak ang kola dirga ka at tokol to dra FDA malubin CDC lo oti lo se tirgel ngilo one dose el Johnson & Johnson malubin J3 girin mamalaringir el at time direct kalmam sa dalwa se selong ede lo rusra igagi el mRNA vaccine sa Moderna ma Pfizer ala amo direct kalmo volkangeri mamora ar adro kuy ditta dire ko koro omes lo seng wangarang at tetele la timeline bodo top der se igidil long ede lo rusel degal dil bort dirgel immunocompromised mora restra a population.
President takari ka egor ka tidor ka fal ngartiang le sera Monday emlaring isel press conference ra tiagi dali ka covid President takadilu wase ya akwa di soka wala di clarification sa statement ra lo ko say tirgel adal ay gagidal asymptomatic cases adi ka ba tutel labor hospital but because ay ka first cases ra blur belau ngiri titrin mo hospital aku gaya siap kau siap tirgal asal tetek asymptomatic cases ang asal adilo amas kertir temrera belu magana sige ti ako adi
Dega adol korina se tel hospitara sel bom sel mral smer te rakt mare ga ider raktem namo bring ra outelil marang egmor hospital retia ngosong saya dega sodal dingang idil adal dega raktel covid dega sel ga idel symptoms ra rakt ngarin un hospital lega da wadol ngeta betel chen morgen malos peanges di adal ngarabalu letseng ngobati rakta agiren el simra blind der yelo mais degal degal restricted movement ang gagirel quarantine rabli sia omasin regal blure lara blue amrigela sia loruri gagidel adal smer adi quarantine rabli quarantine adi wal ngar hospital der lo mais di sia of course we require gidel ngari se clown marar git lo se tamran makadong you know aulang regel program regel tel upgrade ra cellular system rigid o se tragarar ada mangana yagida a help rigid ra yagida lo yor sura
Okay. Sulang kafar ka dilu wase.
okay jamel answer kabung
So the question then is regarding isolation of patients when they're COVID patients when they're asymptomatic. We don't want to occupy isolation, the isolation ward, and we want to make sure that it's available for those who have developed a severe disease and require the medical care. So the question is, what is the best way to, I guess, isolate those asymptomatic COVID patients? Will it be adequate to have them self-isolate at home, restrict their movement, or is there any other strategy that we need to look at for those asymptomatic positive cases?
Yeah, certainly there's different approaches that have been utilized in other places to isolate, because you're absolutely right. The key is you want to maintain the ability of your hospital to be able to care for the sickest people that come in, and so it's very difficult to fill up your hospital with people who aren't sick but just require isolation. So there's been several different techniques that have been used, and a lot of it hinges on sort of what the environments are like where the people come from. So in Guam and throughout the U.S., we use home isolation, and oftentimes augmented with additional check-ins and monitoring. But oftentimes those homes have to be approved, that they're not in a home with a whole bunch of other people that they are putting at risk by being there. And so then some places will look at other, creating other places where they can isolate folks that is not in the hospital. And so I think the decision of what is the right approach for Palau is something that the team certainly is discussing, and I know that you guys have planned for this as well previously, so certainly looking at it. But for the first few cases, I think everyone has been very tight about isolating them. But eventually you need those hospital rooms for patients, and not necessarily COVID patients, right? There's a lot of, unfortunately, people get sick from other things that you'd want to put them in the hospital for.
Translate. Okay. So a question na kafar ekorgal ka dilu wase. Kami recognize ra effort ra other take it upon themselves to wear mask. Sila para sto malbeto. Di ka wase even though in dir ka a mandate na to dara malun directive na to do wase ka mo blue bela mo namo point do wear a mask. And siya mo wase at what point in top say the mandate ra public health.
I see. So lang nakambesara will get. So ako mention sa gid ang mitigation plan ra in EC sa nga niya gid klawal stages, ewal stages. Sa gid el mo require el mandate tamas ka selblalbol klo a predel arak tra al selabalu al digial sa bel public health lo tugur ma hospital lo tugur. Sa gid ang yan mo girir other oilo mask. Again, pas ka mamatay magi mo osisak o sisak ka ada belum di sa gid sel abayong ito sa selbol time el gimolingit lo sa bodo mask rugoy el katmok lar adal mo follow sa gid mel al time mo will the practice the practice mo ngani aromas ka makan mo comfortable aktire kam no do literal leadership alak alwid lo sa head start tadim lengil mandate trangal ka last year el mo mask mong whole school year low mask mel al school year apol ko school tirkas maulo mask. So edim lagi mandatory edim head start edim lagi luli so kadamre nga sulir gaygi dagel bebira initiatives el kadamre nga sulir adra balu amat tilgiri lingwal dil tir el gut makli mesel bol time el gamama mandate eng ada asmauringi so agi mo mutal mo makatakar sa igid el plan lo sa at what point ngarang akat magil ngarang igid el marul hindi kay igid loro el alta may kay igid ya wall foundation ay kay igid el practices among kada mring asulir adrabulu uling ita se bas kama ma tal sunday ngerul sunday ko kora mesa sa igid el plan mesa tele la doctor Thane mong man si angin mongil merko ko dum kama ma NEC amo maralo o top dringin morabuelo sa stage 1 na kada makarang stage 2 makarang stage 3 mas stage 4
adi da lise lo sa kada malmol mga school malmol mga kabaldin malmol mo meeting ay gado malmol mo rogur el all time lang diak sa gida mo sa community spread ay say ay ga imported case buwas am ra ikra blur beral me process gida rom da mam nam da isolate mung dia ka maulay gal activity adi malmol diesel ulo close gidel yadir murtra blue gida ukna me wase gid ma gid additional gida marul goradi sogal direga lo ay surase along that line askogi dirga malmol malme ngare gel skogi ra taiwan al dirga malmol malme ndaka borrar ndiar ad kada ya dolmol mersigel protocol brother lil kada testra day 1 testra day 5 at Taiwan malungil at Testra Airport ruel nga sa Askogi kita uktikal sa drubli sa Rakwam kada mamruni irbelaw ilang uktikal dekal capable Rakwam mang edi do ay so saying tara ulang close to trail legal flight at the other muragurul in a normal year and medal del dartel ada mora todo belan mora referral like blur belaw because rarak. Just to give you some information, el arragan dirga tart 107 am namarayan. Mar klol ngari or sel niya normal. Kabangal tangateng ngon mo legal flight el mora kwam, mangari am la mora tripler, 6 am la mora tripler, 12 am la mora huriping. Along mo legal flight at Taiwan am no sebela another almost 10 and maral emla open cell McKay's hospital umla mo sa sa na mo McKay mga arterial patients sa dirgon mo nga McKay Shinkong of course ang malarte ang sindara adamang this other udira help para problem understand sa medical referral as the flights become more regular and mo better get all duro kara adal mong MA kadam na yung mal buto kara adal nga list temral dia mo kodong lo sen kama mangarap dari sa maral mang dia mnamo start open mon mo clown will get there and we know lo sen ari ada mal los pa guru sula ina so kan share sa igit
President, I think we've asked enough about COVID and October issues.
Sure.
Ang mereka sulam tilai kita tikal stop omralem tukar mlaralistem kita tial madingil ngaring di milingin melamat. Question na nga ka sab eledim clarify sel omral mura sel specifically huriping ngaring akura limit detail al adamral al uben sab ela omral di malmol malmora huksel side titel alaura kidel mo.
Hindi ka limit hindi process amal o widle kamangal process hindi kadang tata na mo 12 la adamo kita tena ba blidera huriping matriba chlora capacity kita huriping it's actually chlora hataiwa hindi mo yora yidele hopefully mo sa tagel flight ra huriping mo betara ada kada dire kal mlangin tra United ro ase uktra alsa tal sande bem tu akar belaw you know United adrigal gel lombe so sing ari opportunity dia mang geda dolas leng oise gurula cloud to telen
Sula Mr. Presidente tenemos esta cuestión a cuestión amora Mr. Werbelao la singani ngwangara capability malu bentisiela hospital kadagor anticipate kung batokal ada momran merbelao dal ada belao dire ngani tourist ngwangara il disela testing git el sabiul administering ira al sela airport sel belger mesel 50 material cook mo o departure abela wangarak lungil ay gagid el testing git tomara al malubeng tela available ngangir bela olen al sumag continue lo ay sige de lera donda sa kung girel maklo amral misois
Naman sulang na malungil gere Mr. Talams el alta Michael antigen test kit sa gel wal qura di sala trim ay malbung to the result lagi mal butok ngara tela la dir ko dolab hindi aul magi direct el qura so mamal el expand testing el mura private clinic at tila igid luldas lo se oral mo to qara adal may mamrail eng mo require butok el test kit sa mong agi murur inventory al time mem na mo realize sa na mo gid el ka order especially albert close procurement mang age ongoing lurior and enough for test kits at time for at least the next month or two el dimuk kay the private clinics mang bay so kal duli lo sing la morning at time makaduguk mo ulangas sel ara la test al time in dori dala 50 cents or 25 tala ara la test 5 tala 50 cents sel result mang morning at time makaduguk mo ulangas sel gid ara la test el mora travelers leng mogire de lo maaringir outside directly from tirigel marula mga mokla test mong el al time mong enough test kits egi direct lom dasulo se alboringia community transmission and direct gire del ku komes la testing ral sela volum egi gida qora bebira consideration gi mo mesleng sum gukmal dimaral mo toka test di tester adal ngara umral di gal necessarily gido sigas mer yang direct gire del amon mas sel aral mo o ulm sa edel mut el procura bebira test kits and di al time enough test kits
sela presidente tela molaste el sumangani ade Mr. Werbel algora langutial fully vaccinated e volunteer mo voluntary tiral isolated kongong ergi makadora tal de experimenter other belal el mo volunteer el mo smer e kada mesak mo angrang al sumangani other volunteer kongong ergi
gora dagal sa comment til al time sa doya ndi al ul hospital mo suguma ada raktela ul mingirel ngania gora adlobang isegi dia ul mangania adlobang dia ka gora wasega the experimenta exposure mangarang agumda se dia ndi moyor tirgel toktang ma adlo mesrasme lo setiang wangara tetele le tiria mega determination lo sa adal newing ng hospital attendant tang makarang segi dia gora
Subila al mutelaste, Mr. President.
No, Mali. For you, always open.
Ngariar ade, Mr. President, el guara namo soril marael, tobra kred belau. Togra samariat telo marael, ndi tirgam la ni criminal gay setiril, mgegrel di luper belau, ndi tigal sabril muram rigel. Ngariar guara telem, el guara la mesa sel issue mo sabril tiragidel. Tirgam klungal ade, guara namo soril moldingran el gere tigal sabril.
Tira of course en suadro mugela blue rambrigel and digida yada understand se alamal tela adam mo soisa blue rambrigel lamal tir mitriga gado bai yada language and gado se me la calboria geyser kami se a first step course en sedro lingit maria process el sedal apply visa US embassy sedal mo apply visa ri di sel best el gurul tilanga don't do it keep your record clean ya mal betar gulto indi sum gamna tuak le process agya dal mura embassy apply mral mringan kada para ala kalwida kada para 500 de kal kan interido set musida visa ndia go to trela ada understander say podagregikla and I know baby at time ngare yeru lidam kada Vice President, Madam Porta Vice President tutora sa igal gates ngara bla bulisa agati dim el tela le mo ga el tela le magara kada. Kura di reminder ko se Ayaya ulang mo mring kami at mura bluram regal mo act responsibly. Of course kalau mo bluram regal, so that's something negotiator aware ngi and as and kurang mo ado tilgiran. Sulang.
President Tower o mga simren sa MLD give a update there's still issue ra nga budol waseng border ka PPLA nguram la ura re ra mo ra atal nuclear tin mor oigul lal ubeng seng kora kirelike. Thank you.
Oy, hindi ang sa man update rin de sa tela ministero biya.
Sulangi. Me amal da albayasado ka o last te olgrila ko de aldo last te sa wer o mong simmer mo. Sulangi olgrila aldado amrar el angal lobanggela asil land authority ra state rai makuk leadership rai algirela igel bot open al latra a oigul el mosbe elo الأقامديت الترجي جدل الأذل غرا عبود المترجي لقوق بأس الأذل الموس بيرا program هذا مدينة الواسع الدورة عبود لا أملارا PPLA إندي كده مدينة كان مدينة اللي كانسرنا نامدو مرا أرادر أولبي لما president الكيرل أو سبيلا قال أوتمر airport رايجل مرا المقتغري الواسع ngara kad mo spell niya mo suporta operation na maudor airport mo audor el ang amra lo pangela air state ma alend authority ringi ma a PPLA mo officer kita a ministry o edik TL wasya yel project rael maral ma Bleda announce rawil mor oyul ay game lamang mereka bidani president makadam na hour mang hour construction aladi medul mamul
wadi follow up presenta wadi clarify wadi confirmation maral la tirgan de border PPLA am la mo terminated na mereka lubet yang wadi ka ngaraudas Alam dito luloy drama say.
Yeah, malungil question. Kada mara lulu meeting alaman 3 rogoy lulu tara courtesy resignation from all of them. Ngari am le submit, ngari ar dimlak. Trigal dimlak bleda terminator tir. So tetedea bleda terminator tir tetedea tim le submit a courtesy resignation. So Allora, abbiamo enough discussion on COVID, ma PPLA, ma dopo io come pronto tre al silsil recognize tira o tal mashura qabilment tirgide border tira al sil so congratulations and mora bun silas ara customs niregal ngani Roderick Bauso and ngara narcotics NEA the vice president emro ngara zilia kabakol ngara behavioral health ngara MHHS congratulations happy birthday adios لهم قلتنا ترابلو بالوضع لهم قلتنا ترابك العادة هذول من بغمان بسولان الكاتة